Meet SnapshotNIR by Kent Imaging, an FDA-cleared and CE-marked medical device that provides real-time insights into tissue oxygenation. By using near-infrared wavelengths of light, it measures tissue oxygen saturation, oxyhemoglobin, deoxyhemoglobin, and total hemoglobin in the microvasculature. The device can be used on almost all skin tones, anywhere on the body, helping clinicians provide quality, individualized care for more patients. It is the only near-infrared medical device on the market today with the unique hemoglobin view. Objective data from each panel combined with your clinical reasoning can point out areas of inflammation, infection, or vascular compromise. It can help you quickly detect tissue viability, as well as underlying conditions such as venous congestion or arterial insufficiency. Efficient assessments mean you can expedite vascular referrals when needed. Use real-time visual feedback to direct clinical action for advanced therapies such as HBO, compression, CAMPs, and debridement. Assess wounds intra- and post-operatively to support surgical decisions to reduce flap necrosis and complications. Take it from room to room, clinic to clinic, whether in a hospital, operating room, ER, outpatient center, or mobile care. You can use objective data to direct interventions and improve patient compliance. When patients see what's happening, they are more engaged in their recovery. Backed by years of research, it has never been easier to integrate this technology into your workflow. A thorough wound assessment can help detect tissue viability. Direct patient care with oxygenation mapping, objective data, and wound sizing. Protect your patient with focused care. Provide enhanced documentation with high-quality clinical images illustrating medical necessity for pairs. Trusted by healthcare professionals across the industry, SnapshotNIR can help provide insights for clinical decision-making and improve patient outcomes. See beneath the surface. Seeing is knowing.